for here we go. Thanks to everyone for joining us today for today's TCDD Disability Policy Academy entitled Disability Priorities for the 88th Texas Legislature. My name is Scott Daigle, and I am the Public Policy Director for the Texas Council for Developmental Disabilities. I am a white male, 50 years old, with short brown hair and glasses. For those of you that don't know, TCDD is a federally funded state agency whose mission is to create change so that all people with disabilities are fully included in their communities and exercise control over their own lives. TCDD coordinates Disability Policy Academies to provide policy professionals with an opportunity to take a deep dive into a specific disability-related topic. In addition to learning about the topic, participants also engage in discussions with their peers, connect with other leaders, and leave with action steps that they can use to implement in their work. For today's Academy, we'll be hearing from a variety of organizations about their policy priorities for the current legislative session. We're on day 65 of the 140-day session, so we're almost halfway through the session. But committees have only just started meeting regularly to consider bills, and the full Texas House has not yet passed any legislation. So we're sneaking this discussion in at a good time, I think. And we've got an amazing list of speakers for you today, so I'm happy to be having this discussion. A few housekeeping notes before I turn it over to our first presenter. So this meeting will be recorded, as you heard shortly ago. CART's closed captioning will be available for the meeting. Attendees should select the button in the bottom Zoom taskbar if they wish to see real-time translation. And the chat feature is disabled, but please feel free to place any questions into the Q&A feature. We're going to be saving time to answer questions at the end of the program. And now, without further ado, I'd like to introduce Jolene Sanders Foster. She is the Advocacy Director for the Coalition of Texans with Disabilities. Jolene is called upon for research, policy analysis, and recommendations to the Texas Legislature and state agencies on issues surrounding disabilities, particularly those affecting children and youth, including early childhood intervention, ECI, inclusive childcare, special education, child protection, school discipline, and higher education. Jolene has been working with children and families for more than 25 years in various capacities, providing direct services, conducting research and program evaluations, and advocating at the local, state, and federal levels for policies to protect and advance the rights of children and youth with disabilities. We're excited to have her today, so take it away, Jolene.
Thank you, Scott, for that introduction. I'm really happy to be here today. I am a 45-year-old white female with long brown hair and black rimmed glasses. So today, as Scott had mentioned, I'm the Advocacy Director at the Coalition of Texans with Disabilities, where we have a very small advocacy team. And we typically kind of, like most organizations, everyone has their specialty area. And I'm going to try and do it justice because it's I think perhaps the biggest priority that CTD has this session. But attendant wages, the wages for attendance, this issue has been left behind for far too long. Currently, for those of you who aren't aware, the base wage is $8.11. And so our fearless leader, Dennis Burrell, our executive director, has been leading the fight on this and is asking, we are asking as an organization and with all of our other partners that the legislature raise that at least to $15 an hour. These are very low wage jobs, very, very important jobs. It's hard work. There are no benefits. And for this kind of work, for the workforce to sustain, we really need to raise those wages. And so, like I said, Dennis Burrell at CTD is really championing that. A couple other priorities. Chase Bearden, our Deputy Executive Director, is working once again on medical cannabis, as well as voting, and protecting individuals with disabilities and making sure that their rights are not violated or inadvertently impacted by some legislation to tighten or to restrict certain voting. We also are working on criminal justice, youth justice, adult criminal justice. We know that individuals with disabilities are disproportionately represented in that population, specifically individuals with an intellectual or developmental disability, and oftentimes they have co-occurring mental illness. So we do have our lovely Jennifer Toon, who leads the way on that, to ensure that there's access to medical care. First of all, that we prevent on the front end people with disabilities from getting caught up in youth and adult criminal justice system, but that they also have the accommodations, the access to medical care, the access to education, which is something a lot of folks don't think about while they are incarcerated. We are also working on inclusive childcare. We partner very closely with Lauren Gerken at TCDD on this issue. Representative Mary Gonzalez has filed a bill, HB 211. This will be the third session that we're working on this, and as some of my colleagues can probably tell you, it's a marathon and not a sprint. So hopefully third time's the charm, but this would ensure that childcare providers are aware of their responsibility and their obligation to comply with the Americans with Disabilities Act, which basically says you're a private business now. You can't discriminate and just say we don't serve kids or we don't take kids with disabilities. You first have to consider if it's going to fundamentally change the structure of your program. Then you have to consider, is this going to pose a significant financial burden? Or is there a potential risk to health and safety? So those things have to be considered. Can we provide accommodations and modifications before you can have any kind of blanket policy? So we know that getting access to childcare is challenging. Keeping your childcare is challenging, and this we hear time and time again is such a critical issue because one parent ends up having to drop out of the workforce to care for their kid. It also has some other provisions in there for ensuring that caregivers are prepared and they have the training to be able to work with kids with all types of disabilities. We don't expect them to be experts, but to be able to have the resources, have the base knowledge, and at least know where to connect if they don't have the information. And then finally, in that bill is also a provision that would ensure that ECI providers, if they're serving a child through early childhood intervention, that they have access to be able to support the kid and implement their individualized family service plan while they're in care, because ECI requires that that you serve the kid in their natural environment, and childcare is one of those. But we know that there have been barriers with ECI providers being able to actually go out to a childcare center and provide those services, and it's such a critical service. Finally, I will wrap up with some education related and child protection issues that I personally am working on that are critical issues right now. Some of you may be aware, we joined forces with a number of disability advocacy organizations and held a press conference back in January to once again address instances of abuse and improper restraint, use of force on students with disabilities. And some of the things that we heard were just horrific. Things like biting a kid, slapping a kid. And our organizations kind of all got together and stood up and said, nope, this session, we're really going to tackle this as a united front. And so there have been a number of pieces of legislation that have already been filed. HB 133 by Representative Mary Gonzalez, who's always been a great champion for people with disabilities, would eliminate the use of and specifically outline that prone and supine restraints are not allowed. We know that these are types of restraints that restrict breathing and in worst cases result in death. We are also supporting our folks at Disability Rights Texas who have worked with offices to revise language to the cameras bill that had passed back in 2015 that would expand places where a camera could be placed in terms of the educational setting for the student, and also ensure that there are some safeguards where parents will have access or there is a mechanism where it's very clear to the school, this is the process for a parent to gain access to video footage, because what we're hearing is a lot of times is that the parent was not allowed to see it. The school would say, hey, we'll look at it and then we'll let you know if we think that this is abuse, and these individuals are not, they're not independent. So we also expanding the do not hire registry, which initially was kind of established as a central database for educators who, for instance, had improper relationships with students. And again, we know that educators who harm kids, they should not be permitted to just resign in lieu of termination and move on and continue to be impacting trauma on more children. So this has some specifications for those who harm. We also, CTD is working on a revision to the Texas State Penal Code that has to do with use of force on a student, and very clearly states only in an emergency, to the extent that the emergency exists, and only the amount of force needed for the emergency. As it currently stands, the way that it's worded, it provides blanket immunity for anybody who falls under that umbrella, an educator, a volunteer, a staff member at the school, if they have, if there's an instance where they have used force. And again, when I'm talking about force, we're not talking about, say, a sum of restraint that has, that is executed appropriately in an emergency. We're talking about, again, these instances where kids are getting thrown into walls, getting dragged. And this is really, these aren't emergencies. I will give you just one short example and then I'll wrap it up. There was an instance most recently in Houston where a girl was dragged, picked up by her legs, and then dragged to a garbage can because she didn't want to throw away her utensil after lunch. This was a kindergartner. And so these are the kinds of things that we're talking about. Use of force is obviously not necessary for something that small. Finally, we know that students with disabilities are disproportionately represented in this practice of early pickups. It's also been referred to as informal suspensions, shortened school days, where a parent is contacted and the school says, hey, Sabrina's having a bad day. You need to come pick up. Or, hey, Sabrina's having a bad day. Would you like to come pick up? Or Sabrina, sorry to pick on you, Sabrina, you were just the person right next to me. Or Sabrina is having a really good day, but we want her to end on a good note to build, continue to build on the success. What that does is, because they are informal suspensions, that removes the student from the classroom, from access to all those services that are outlined in their individualized education plan. It often leads to more severe disciplinary measures taken against the student, and it circumvents this protection in federal law, which basically says, hey, if a kid's been out of placement for 10 days, which could be suspensions, we need to have a manifestation determination review to see if this, whatever behavior it is a manifestation of the disability. And then we've got to do all this other stuff to make sure that we're supporting the kid appropriately. When they're in formal suspensions, even if picked up half a day, picked up, right when they get off the bus at school, those are supposed to count, but they're not documented. And so these manifestation determination reviews are not being completed. Students are getting, placed in more restrictive settings like a disciplinary alternative education program. Parents, I talked to a parent just probably a week ago, getting truancy notices, and how do we defend this? Because I wasn't willingly keeping my kid out. So this is really problematic, and essentially just leads to a whole bunch of really bad outcomes. With that, I hope I didn't leave anything out. I'm talking to my CTD folks who might be on here, but I appreciate the time to be able to come and to talk about some of our priorities.
Thank you very much, Jolene. Excellent. And next up is Chris Mazie. Chris has shifted into a consulting role after several years focusing on disability and special education advocacy, currently serving as the lobbyist for the Texas Association of Behavior Analysts Public Policy Group and the Autism Society of Texas. Chris was actually one of the first TCDD policy fellows at the Coalition of Texans with Disabilities in 2014. So thanks for joining us, Chris.
Thank you all. Yeah, it's TXABA's PPG is a mouthful each and every time. It's very, very appropriate that I'm following Jolene because I follow Jolene and Stephen around at the Capitol all the time, begging for help most days. And it's also appropriate that Jolene was talking about one of the issues that I think is very important to the Autism Society, which I'll expound upon. But one thing Jolene said the other day, and very brilliantly put it with talking about the early pickups and all the other abuse issues, were that children are being criminalized and abused simply because of a manifestation of their disability. And I think that's something that is too often forgotten. It's a very emotional topic for those of us who are parents of kids with disabilities as well. And I just want to put that in because that's a phrase that Jolene used testifying last week that to me just really kind of nails the problem with the issue. So enough of that. I'll go back and actually start my presentation. Yeah, I work for the Autism Society of Texas. I used to be the director there. Made a bad decision and left. And now, luckily enough, they've taken me back. So I'm lobbying for the Autism Society of Texas, who, if you don't know them, they're an affiliate of the Autism Society of America. And with the rates increasing from 1 in 54 just a few years ago to 1 in 44 on people being diagnosed with autism, the Autism Society's reach has expanded a lot. There's over 500,000 people with autism, and then of course all their families that interact and deal with some of these issues. And the Autism Society is very different. They provide a lot of community connections. They try to empower the community. They have resources, and they're really looking at folks trying to live full lives. I don't know if you know this, most people don't, but the Autism Society has an information referral hotline, if you want to call it that. There's just tons of information about any question that anybody asks, and it doesn't come from just Texas, from the United States, from all over the world. Everybody wants to move to Texas. They send us, questions about that. They also do a whole lot of educational webinars, multiple support groups and all over the state. And of course, Texas state advocacy and national advocacy. Really fantastic and wonderful organization. I'm so pleased Jackie couldn't be here today because she's playing around for spring break in New York, but I'm glad to sub in. TXABA, the Texas Association of Behavior Analysts, they set up a public policy group. It's a 501c6 several years ago, really as they felt that there were many issues that were impacting not only their profession, but the clients that they serve. And so this group has come together. They had a lobbyist who retired, happened to be a good friend of mine, and that's how I kind of got into this whole lobbying thing. I want to say something about TXABA that is so unusual and so wonderful, and it helps me a lot as a really a former and current advocate, is that they care deeply about the kids that they serve, kids and young adults. And the violent restraint issue, ending these just is so important to the group. They continually support and want to be part of that discussion. They were there being helpful at the webinar. It's amazing to me. I get pretty excited about it. Also, their steadfast dedication to their clientele. So I'm going to talk about a few brief issues that we're dealing with, that both the Autism Society and TCDD to certain extents. So it's fantastic that Jolene mentioned all the ending violent restraint. We also want teachers, if we're taking a tool out of the toolbox, which I think is an awful tool that they have, we also want to help them and add other tools. And I'll talk about that briefly, but I want to again credit TCDD for being willing to talk about those issues. And we've got about a dozen different bills that we filed. I'm not going to go through all those, of course. I also want to thank TCDD for their bill of the week with our IEP team bill, HB 272 by Julie Johnson, and the Senate bill is SB 1539 by Tan Parker. Thank you so much for supporting that. As Jolene mentioned, it was it has been a multi-year bill. Each and every time we find there's some reason for it not to pass. We have a Republican co-sponsor on the companion, and so we're hoping that in the Senate we'll maybe have an easier time. The bill has already been heard and testified for in the House, and we hope to see it move along with those respectful language bills that came up earlier, I guess last week sometime. So we have bills that, for the Autism Society also align very closely with some of the things that Jolene talked about. But for TCDD, we have equity bills and efficiency bills. Some of those are scope of practice, but the equity bills are really about making sure that various entities, insurance companies, managed care organizations don't discriminate against kids with autism. And we've got a couple of those bills. Representative Cortez filed one, HB 4506, which simply takes out some discriminatory language. Kids 10 years in a day wouldn't qualify for private insurance before, and also a cap, $36,000 a year on the benefit that they would receive. Eliminating that was extremely important to us. However, in practice, it's not really an issue because the mental health parity laws, they can't discriminate against our kids that way. So what we wanted to do was some cleanup language with that bill. We also added another bill that includes that, and then some settings rules where behavior analysts can actually see a child when in the setting that the thing is happening. So if the parent tells the behavior therapist that a lot of the times the transition between, school and the bus or school at home is one of the most difficult situations, that behavior therapist can actually observe. Currently, the only settings that they can observe and make these get reimbursed for is in either a clinic or in the client's home. And so we think that those are important things to address for equity and efficiency. And those are just a few little things. I won't talk too much about them, but the important bills, the ones that I want y'all to know about, is specifically that we discussed when we were talking about the ending violent restraint bills and taking that tool out of the teacher's toolbox. We felt like we needed to give a tool back. And we hear it over and over and over again that although the teacher has a lot of classroom management training, they don't know how to deal with students that have autism. And so we put a bill together and a rider that adds a behavior specialist at every educational service center. So everyone, there's 20 regional service centers, and in those, there would be a behavior specialist. What we found in the past when we did that with the dyslexia specialist was that teachers, districts, everyone had this source of knowledge, this person that knew more about this particular issue and could help everyone. And so we're really pleased that Representative Dutton with HB 4093 has filed this bill. They also filed the rider. The rider is $5 million per biennium. It's essentially a very small rider. And Senator Menendez filed the bill SB 1797 in the Senate. And so we feel like having a companion and having the rider all together, the rider would also create and fund this too. So we have essentially three ways to get this bill passed. DRTX and CTD and others have supported this effort. We think it's a variant T case as well. We think it's a very important thing to add this extra tool back for these teachers that say they're having one taken away. One of the issues that Scott and I kind of discussed beforehand was dealing with the budget. And I think that y'all know that the budget has been difficult to even understand where some of the funding comes from, where it's aligning. And I will say that no more a lack of transparency and no more information that we've gotten for certain programs. The worst one is the Autism Medicaid benefit, which has now been renamed the Autism Medicaid Services Program. Now that passed by rider, and the program was created, or should have been created, 2 sessions ago. Last session, we got the rider again, and we actually added in $112 million and a directive. And that directive said February, a year and a month ago, that HHSC would have to start the program. So after dragging their feet for essentially years, we have the program, the rules have been created, and things are going, at least they're moving. What we wanted to be able to do to advocate for the appropriate amount of money for the budget was to know how much internally HHSC had dedicated for this particular program. Because this program was made by rider, and because the funding came from the Children's Medicaid program, Children's Medicaid program, which is $11 billion or something in GR. Because that program is in there, there's no goals, there's no cost per client, there's no real information about it. Pardon me, there's a cat in here for some reason, I apologize. Because of that, we don't have the idea of exactly how much they're spending. And so we wrote up a brief summary, it's actually a full page, on the lack of transparency about how much money we spent. Jackie Benestante testified both in the House and the Senate about this. And we did an estimate based off the numbers they did give us, which were back in 2020 in the 86th session. In their LAR, they allocated $192 million. So I basically took that, added on that amount of money that we expected them to serve, and we were asking for about $224 million, all funds. We still don't know how much that the program should be budgeted, but I think the work groups in the House in particular will give us a better idea of that. Because we couldn't get transparency, and because we've, in good faith, really negotiated with the executive commissioner and others at HHSC, we decided to take a little bit of a different tack and create some bills that would essentially force them to have transparency. And so what we did initially was create an an advisory committee. And that advisory committee, since we had already asked the executive commissioner, and they have the ability and the responsibility, in my opinion, to do so, we created one by statute, one bill by statute, one bill by rule. And then we also did a rider for that. And I will be sending them a letter the next week or so to ask them to go ahead and convene this advisory committee so that they can get together and work on the implementation of the program, which has been way too slow, so that we can have some idea of what the numbers that HHSC is serving, of the dollars, of the cost per client, all these things that we have with many other programs. And so I can give you those bill numbers really quick. I'll just run through them. We have HB 5014 by Gomez and SB 2178 by La Mantilla, HB 5020 by Gomez, 2177 by La Mantilla, also on these two bills by rule and by statute. We also have two riders, one by Representative Howard and the other by Senator Zaffarini. Representative Howard's wonderful rider actually adds in a date certain for them to do some rate settings as well. And so we're really pleased with where this is going. We'll be writing that letter to the commissioner and telling them to go ahead and do the committee. But that is one of our big pushes, besides, of course, the ending violent restraint. And so while I'm on the budget, I want to explain something that most folks don't know. We just created the autism Medicaid benefit. Pardon me, I don't know what's going on with this cat. It's going crazy now that the children are out of the house. We have the autism Medicaid benefit, and it's a wonderful program. It's just started. We'll hopefully see that program grow. We had coverage through private insurance, but the children's autism program falls in the middle, and it helps a lot of people. Those people who really are don't have private insurance, maybe they have self-funded program and they fall in this middle part. And so one of the things we're asking for is not just case growth, but also adding the 12.33 budget case growth, what do you want to call it, state growth, that the comptroller said that all of Texas should have. So if Texas's budgets grow and the LAR from HHSC didn't grow, we think that they should add that 12.33% to all these programs for case growth, if nothing else. And I won't talk about budget anymore, but the last bill is the autism supplement. We have found through discussions with the Children's Policy Council, Policy Council for Children and Families, as well as providers and other folks at the Autism Society, that many times when an IEP team is meeting, they gloss over the autism supplement. And in fact, they've been giving directive by TEA that they can just say in a blanket statement that they addressed all the issues with any of these 11 strategies that can really be helpful, I think, for all students, but particularly for students with autism. And so what we want to do is inform parents about the autism supplement. We also want to make sure that during the IEP team meeting, some people call it an ARD, but I don't. It's a big joke between other folks. What we want them to do is slow down, take each one of these strategies and say why or why not they are being applied in the IEP for that student. Those bill numbers are HB 3233 by Josie Garcia, who's a parent of two boys, I guess they're adults with autism, and of course, Senator Menendez, SB 1795. We think that this bill is a really fine addition to our bill group, and I think that's all I have. Yes, it is. I will stop. Thank you, Scott.
Thank you, Chris. I appreciate it. So really quickly, we are going to try and not use acronyms, or if we do use acronyms, we'll try and answer any questions if people have. I believe Chris referred to the LAR, which is the Legislative Appropriations Request. I don't know if that was clear. And yes, and riders, appropriations riders are requests for a direction of funding to say that you're using a certain amount of funding in a very specific way. So that's what the rider does. Next, and I also wanted to mention that I know that we are throwing a lot of bill numbers at you. In the follow-up email that I send to all registrants and attendees for the event, I will try and go through and create a list of every bill that was mentioned over the course of this discussion, so that I know that everybody's furiously jotting them down, but we will try and provide a full list of everything that was mentioned here. With that, I'd like to turn it over to Linda Litzinger. Linda works for Texas Parent to Parent, covering public policy, advocacy, and leadership. She helps parents to become advocates and leaders in their communities. She also serves on the Texas Higher Education Coordinating Board's IDD Advisory Council, on a transition advisory board at Sam Houston University, and on numerous coalitions. She is the parent of a self-advocate, Amy Litzinger, who is the policy lead at Texas Parent to Parent. So take it away, Linda.
Thank you very much. I'm very glad to be here. And yes, Amy and I are two halves of our advocacy team, and we take turns speaking. Anyway, I am not going to repeat anything I've heard. We are absolutely for everything that Chris and Jolene have said, and so I will embellish it a little bit. First, I'd like to talk about vouchers. Vouchers are going to be big this year in the legislature. Sometimes they're also called education savings accounts. By whatever name it is, let me tell you a couple things. First of all, there are charter schools, and those are public schools, and they owe a student IDEA. Sometimes we have kids fall out of charter schools because they don't realize they owe IDEA supports. And so then we also have private schools in Texas, and the vouchers are to privatize more of public education and send people to private schools. What all parents need to know is that they don't owe you any supports under IDEA. Absolutely no supports are owed. And that it might be more expensive, that your voucher may not go very far there. The tuition may be more, and they may upcharge different things, like if they do provide speech therapy, they may charge you for that. While we're on the topic of education, there are school safety drills that everybody's pretty used to now. And that could be an evacuation, or that could be a hold in place kind of drill. And there is a bill that says when for each IEP, you need to have a conversation about what is the individualized plan for your child for these drills. And I've heard some pushback from teacher organizations that say, look, some kids only need speech therapy. They don't really need anything special. But that's just a conversation you're having in the yard, and then you can put something more in writing or not. Just say you've covered it. Then we have seen a very interesting bill. We do a lot of mental health work too, in addition to just talking about disabilities and children with special health care needs, because mental health is co-occurring in many cases. And so I saw a bill. It used to be that if you needed overnight residential treatment for your child with a mental health need, and they needed to get out of the house, either because CPS was saying so, or they were saying so to protect your other kids because your one child was being violent. If you needed residential care, the way HHSC kept the costs down was to have parents go onto the abuse neglect registry as somebody who has neglected their child. So often couples would look at each other and say, which one of our careers would suffer the least by us being on this list? And so it was only about 5 years ago when Colleen Horton was responsible for getting a bill initiated, and it was passed that you no longer had to go on this list. So I saw a bill yesterday about how to get yourself removed from abuse neglect lists. So if you are a parent that has been through this, I will get you that bill number. Also, let's see. Chris was talking about how ABA therapy was passed, but then it was funded so low that they couldn't get any ABA therapists to work. And that happened concurrently to the Autism Council, which was wonderful. It had parents, physicians, state people on it. It was sunsetted right as ABA was passed and funded. And that's probably bad timing. So let me talk about some other bad timing. This is a federal law called Dehabilitation, had to end on March 1st and become ISS. And I'm going to try to do this right, but somebody jump in if I've got this wrong. I think it's integrative socialization supports. And what it means is, if you normally go to Dayhab, the ratio has to change of the day hab adults to the adults that are attending. And the function has to change where you go out into community more, but with fewer people. And if it's a workplace, only one or two. It can't be like a work center where everybody has a disability. And everything has to be in a plan that the person makes to have a really great, perfect day or perfect world. And so the first thing that happened was none of the day habs got licensed in time, and they're all closed for the month of March. And the families are scrambling to find where they're going to put their adult child while they go to work. And then the next wave that happened was I just heard about it on Friday and Monday after it's too late to file a bill. But that is that many day habs are closing. And now after having, and they are because they waited out COVID, they only had half as many people there as they would have normally had, and they had trouble paying rent. And so that was absolutely awful. And now they're faced with having to hire more people in order to put this on. And so families are getting called that they're just plain closing, come get your stuff that you're fond of. So there might be a way to add something to a bill to maybe work with the feds to put this date off so that it's just such bad timing post-COVID. We don't want to see all the day habs in Texas close. That would be a disaster. Then dental care for adults was passed as being part of Medicaid, but it was an unfunded mandate. And so we need to get some money in the budget for dental care for adults. And let me see what else I wanted to tell you about. Okay, so here is what Parent to Parent does that's maybe a little bit different than other organizations. We have many disabilities and many age families and many different concerns. And instead of publishing our priorities, we ask families to come to us and say, about a year before a session, what would you like us to help you file? And then families come to us. And so one example is about 6 years ago, all the kids that were having long seizures, like an hour to 9 hours long, where severe brain damage was happening. That's called intractable epilepsy. And there was no cannabidiol oil bill allowed yet in Texas. And everybody said, you're never going to get it passed. And that's all we did. We worked on it. We made 400 visits with 1 to 25 families each time we went, and we passed it. And so this year, we have a group of families who children tend to bolt out of the house. And in general, the law says if you have intellectual disability and your child wanders, we will call that, we will heighten the alert for that missing child. If they have autism, they get a heightened alert. But if they have all the other disabilities, nothing. So we have families whose children have ADHD who bolt. That's not in the law. And they're called missing children, and they won't look for them. And by the time families organize and find the child, a week or 10 days has passed, and it hasn't been pretty. And they sometimes have to go to a residential treatment center because they've been treated so poorly. So we are trying to have a study that studies which disabilities also need to be considered in the bill. Children in wheelchairs that would not have walked out of their wheelchair, children who have to have meds that must be ramped down, or things are very bad if they're not ramped down. Lots of different physical disabilities and mental disabilities and so forth, so that the police actually look for the child and say, do you want to be found, or do you not want to be found? And so this bill that we got is through Rep. Sherman, and it calls for a study group. and it put 16 different kinds of people onto the committee. And we were very surprised that this committee is going to go through 2030 to examine the data and maybe make recommendations. And so today I was just happened to be looking at Stephanie Click's bills and realized that she's got a bill about reporting and training regarding missing children, and that there's a companion bill in the Senate with Senator Kelly Hancock. So that's our big different bill this year. I think next year we are going to be talking about not just attendant wages, but let me say something about attendant wages first. There are many places where wages are not 15 an hour, and 15 or 16 is what fast food is at right now. And so there are wages that are 8.11, but there are also people making 11.50 that haven't found an attendant in years. And there are children that can't find nurses. So we have really got to work on the wages, and where they are right now is they're talking about $12. And I'm going to tell you this, 11.50 hasn't gotten us anybody in 3 years, and 12 isn't going to either. And they're talking about 12 with enhancements, and there are 35 categories for an enhancement. That would mean there's some extra condition or something that might get you up to 13 or 14. None of that gets you up to 15. So we're still working on it. We're still very adamant about it. And we also have some people that are saying class doesn't offer anything in the night. Once you're in bed, you're stuck in bed, you're not in your wheelchair, you can't take care of yourself. It's very dangerous. So it's too late to do anything about that this session, but for next session, that may be one of our biggest bills. And I thank you, and I'm going to put something in the chat. Let me share my screen and show it to you real fast. Sharing screen right now. So, are you all seeing a chart? This is our chart of every legislator. And right now we're on the senator page. So if you want to call them, look at this column C. If you want to visit them, we have their addresses by floor so that you can do the whole Capitol building at once or the whole E1 or E2 at once. Okay, then if you want to email them all the night before the vote, just copy paste this whole column right here into an email, and there are the legislators' emails. If instead you want to explain something, like at the beginning of the session, I offered some documents about what is long-term care to the legislative directors and so forth. So we have the Health and Human Services, the higher ed, the education, the juvenile justice people. And so this is a working list. As we call people, we fill this out further and further every day. Likewise, here are all the reps, all 150 of them. They all have the same columns. Then if you are going down there to talk to finance and appropriations, then this sheet just has those people. Here is Health and Human Services, followed by education. And then the last one are all the priorities that different groups have published and their bill lists. And we're sort of getting permission from them unless they're published publicly before we put anything on here. So if you want to be added to this page, just let us know. And I'm going to stop my share, and I'm putting this in the chat so that you can use it right away. And if you want to save your chat, click on the 3 dots at the bottom and hit save. 3 tiny dots. And that's all I have. Thank you.
Thank you very much, Linda. I believe that Corin is going to put that link into the chat to share with the audience. So be on the lookout for that, and we'll certainly share that in our follow-up materials for the meeting. Next up, we have Lauren Gerken. Lauren is the Public Policy Analyst for TCDD She has about 5 years experience in public policy and about 22 years experience as a self-advocate. She has a master's degree in disability studies and is currently studying her PhD in adult, professional, and community education at Texas State University, where she is focusing on community inclusion and development of people with disabilities. Her greatest passion is supporting advocates in speaking out for themselves in the best way they can. So thank you for joining us, Lauren, and take it away.
Thanks, Scott. Yeah, I'll clarify. I am not 22 years old, but I didn't consider myself a self-advocate until I learned the word no. And I learned the word no a little bit later in life. So thanks. I am really having y'all here joining us today. I am Lauren. I am a 28-year-old female man, white skin, really short red hair. I am in a blue and kind of maroon plaid blazer. So I'm gonna talk about employment today as a policy priority, but as I talk about it, you'll see that kind of crosses into many different things, some of which have already been mentioned in the webinar. So our focus is on employment, really making sure that people have access to equal opportunities on employment, as competitive and integrated as possible. Competitive meaning wages, opportunities for advancement and development, and integrated means working alongside non-disabled peers whenever possible. So TCDD is a wrap on Texas Advocacy, which is the Association of People Supporting Employment Bursts. Employment bursts in a policy in Texas that we have adopted as a state that clearly says that employment should be the first and preferred option for people with disabilities. In other words, Texas has acknowledged that people with disabilities should be having access to employment, and we should be employment minded when looking at where adults with disabilities should be going after high school. That is not always necessarily the practice that we're using, but it is a policy that we have. So if you're ever advocating and discussing employment policy in Texas, you can cite employment burst as a foundational policy that Texas has that recognizes employment as the first and preferred option for people with disabilities. So a couple of things that we work on in general when it comes to employment and continuing to work on a minimum wage. So a couple of sessions ago, the legislature passed a bill that eliminated minimum wage within a program called the State Years Program, which is pretty limited, but that program has completely eliminated the use of minimum wage in that program. They are now paying the federal minimum wage or higher for all the employees in that program. And they're continuing to work on building on that, and we want to as well. So we want to work on trying to expand on that. Another issue that needs some long-term work is addressing the concern that Medicaid waiver recipients have about income limits and working within income limits. So a lot of people have decided that they have a Medicaid waiver, they get employment, and then if they earn any amount over the income limit, you get booted off of your waiver, and it takes a really long time to get bonus back in and get your waiver back. And that's a concern because for many people, the Medicaid waiver is providing the support that they need to actually have that job in the first place. So we want to kind of look at how we can address that concern of if a person works, an extra shift once a month and they get 1 month where they earn $50 on the income limit, that they're able to pay that back before they get kicked off their waiver. There's a long way to go on that. There's a lot of work to go into that, but that is something that we are watching and thinking about. The other thing is understanding that employment and the concern about attendant wages really go hand in hand. So there's this really intricate web of all of these things interacting with each other, where an attendant might be the very thing that helps the person get out of bed and get ready and go to work in the morning. And without an attendant to help them do that, they cannot go to work. So trying to get legislators to understand that not only do attendants save lives and keep people alive, they also help people contribute to the economic foundations of Texas by getting them out and getting them to work in the morning, or being that transportation that they need to get to work. So we're also framing attendant wages as an employment first issue where people can have access to the support that they need to get to work and keep their job. And see what else. The other thing is, it does contribute into higher education, where we're looking at what higher education are people having access to that can help adults with disabilities get training and certification and development there that they need to be able to be competitive in the workforce. We know that the workforce for anybody is incredibly competitive, especially right now. So we want to make sure that people with disabilities have access to the opportunities that allow them to compete in the markets they're choosing. So I can get into higher bills in a second. But some of the more vocational films that I've been watching is the bill by Terry Mesa, which anybody who's worked with me has heard me talk about this a lot. It's HB 1113, which is trying to establish a low interest loan program for entrepreneurs with disabilities. And one of the reasons that entrepreneurship is important for people with disabilities is many folks, whether they have an attendant or employment assistance, even if they have all those supports in place, working a traditional 9-to-5 job can be a barrier to employment, because if you have higher medical needs, you may need to go to doctor's appointments frequently or have physical therapy frequently. And it's very difficult to have nighttime doctor appointments and nighttime physical and occupational therapy. So for many people, it means taking time off work to go attend his clinical appointments. So many people with disabilities choose to own their own business because it means they can create their own schedule and they can work at their own schedule and they can attend all their appointments that they need and work when they can. And that's really a good option for a lot of people. It's also beneficial because, as you may know, there's a lot of ableism in the workforce. And even though we have laws in place that say you can't discriminate against people with disabilities, we know it still happens. So being able to say, okay, well, I'm gonna own my own business and then I'm gonna hire people with disabilities and give them the opportunity to work. We've seen that in many cases. If you know James Parker and his paper shredding business, and he's hired many people with disabilities. We have a place here in Austin. I think they have one other location where it's a deaf-owned business, and they hire other deaf and hard of hearing individuals to come work. So it really expands the workforce within the community as well, which is really helpful. The other legislation that I've been following is, let me pull up the number here. So HB 2598 by government is relating to the Texas Workforce Commission establishing a workplace soft skills training pilot. Now, in the bill itself, it does not specifically say it's for people with disabilities because it may be surprising to know that oh, I gotta know that I gotta that getting ready to go into the workforce is important for everybody, but that legislation will really help people with disabilities as well, getting ready to go into the workforce. So those are the two employment strengthening bills that I'm talking. But if anybody wants to talk employment or how it integrates with all the other policy issues, I am more than happy to chat with anybody about employment policy. Thank you.
Thank you, Lauren. And sorry to wrap it up. I wanted to save time for our next speaker, Sabrina Gonzalez Saucedo. Sabrina is a public policy analyst with TCDD. In her role, Sabrina monitors disability issues in Texas and conducts activities that advance TCDD's public policy priorities. Her main policy focuses include education, criminal justice, housing, and more. Sabrina is also the sibling of an adult with IDD, which is what prompted her interest in disability advocacy. Before you get started, real quick, I just want to say, I know there's a lot of chatter about the broken link to the spreadsheet. We are going to make sure there is a correct link sent out in follow-up material. So don't worry about it. You'll get it at a later time. And with that, sorry about that. Take it away, Sabrina.
Hello, everyone, and thank you, Scott, for that introduction. My name is Sabrina Gonzalez Saucedo. I am a Latina female in my mid-20s. I have brown curly hair, and I have a blue blouse on today. I'm really excited to talk about some of these topics that we've been able to briefly highlight in our TCDD legislative news updates. As Scott mentioned, education really is my bread and butter here at TCDD, so I'll be hitting on that a little bit. And the first topic I'll hit on is special education funding. So under House Bill 1525 from the 87th legislative session back in 2021, the Texas Commission of Special Education Funding was formed. This commission was tasked with developing and making legislative recommendations for methods of financing special education in public schools. This commission released a report with several key recommendations for how to improve the way that we fund special education. And some of these recommendations have already been introduced as bills this session. One of the main recommendations offered by the commission was to change the way that special education funding formula works. So the state of Texas's special education funding model is currently driven almost completely by special education instructional setting. So currently a school, in order to figure out how much funding each student receives in special education, is that they'll calculate what percentage of the school day a student is in each instructional setting. So they'll see what percentage of the school day the student is in the general education setting, what percentage of the school day they're in a self-contained setting, a resource room, in related therapies, and so on. And each of these different settings has a funding weight. And so the school goes ahead and calculates how much funding the school receives for that student based on where they are placed. This formula, unfortunately, doesn't properly capture all of the services that a student receives because it is almost purely based on setting and not the special education services that are outlined in the student's individualized education program. As you can imagine, the problem with this current formula is that it doesn't properly reflect the costs associated with special education services and also doesn't properly compensate local education agencies to appropriately serve students with disabilities. So in order to address this, one alternative funding solution that the Commission on Special Education Funding and others offered was to move to an intensity-based funding formula instead of a placement-based funding formula. What this means is that the new formula would consider each student's educational arrangement and the specialized services that they receive, instead of just looking at the setting that they're placed in. In this system, students in Texas public schools who receive special education services would be categorized into one of 7 different weighted funding tiers based on the types and numbers of basic special education services they receive. The tiers are associated with respectively with a specific funding weight to be applied to the basic allotment and then multiplied by the number of students in average daily attendance in each of these tiers. As I mentioned earlier, there are already bills filed this session that aim to modernize the special education funding formula and to implement some of the recommendations that were offered by the Commission on Special Education Funding. TCDD last month submitted public comments to the House Appropriations Committee on this very issue, and we're going to continue to monitor its progress throughout the session. Moving on from special education funding, I'm going to move into higher education, which Lauren Gerken already mentioned a little bit about. There are some extremely exciting bills filed this session aiming to make post-secondary programs more accessible and affordable to students with disabilities. These efforts are being championed by our friends over at the ARC of Texas, so you already know that they're amazing proposals. And I'm going to go ahead and highlight just 2 of those bills targeting affordability. The cost associated with higher education and post-secondary programs in general is astronomical, as most people in this webinar can attest to. Affordability remains a huge barrier to higher education for both students with and without disabilities, and these 2 efforts aim to change that. The first bill I'd like to highlight is House Bill 4490 by Representative Josie Garcia from San Antonio. What this bill would do is that it would allow educational benefits that are reserved for veterans and their families to also apply to a person that attends a comprehensive transition and post-secondary program for students with intellectual disabilities, also known as CTPs. So currently, military educational benefits for military dependents that exempt military dependents from the payment of tuition, dues, and other fees only apply to military dependents that attend traditional 2- or 4-year post-secondary programs. Now, currently, there are 5 CTP certified comprehensive transition and post-secondary programs for students with intellectual disabilities in Texas. This includes the Aggie Achieve program in College Station at Texas A&M, the Tu Casa program at the University of Texas San Antonio, Elevar, which is at UNT, the University of North Texas, Vast Academy at Houston Community College, and the Lifelong Learning with Friends at the University of Texas at Austin. This bill would allow for dependents of eligible military personnel to use these educational benefits and be able to apply them to attend these CTP programs, which we think is a great initiative and would benefit a lot of military dependents with intellectual disabilities that seek post-secondary education. And the last bill, the second bill that I'm going to be highlighting is going to be Senate Bill 2225 by Senator Jose Menendez, also of San Antonio. This bill would direct the Texas Higher Education Coordinating Board to create and administer the Texas Students with Disabilities Scholarship Program. Again, this is aimed at expanding affordability opportunities for students with disabilities in Texas. And there is a House companion to this bill, and that's going to be House Bill 5148 by Representative John Rainey. Again, both of these initiatives, both of these bill proposals are aimed at making college and post-secondary programs, CTPs, more accessible and affordable for students with disabilities and intellectual disabilities specifically. And with that, that ends my presentation, and I'll head it back to Scott.
Thank you, Sabrina. Really appreciate it. All really helpful information from all of our panelists. I know there's been a lot going back and forth, so thank you. Really quickly, before we move to some Q&A, I want to mention some resources that TCDD is offering throughout the session. If you go to our website, tcdd.texas.gov, you'll find a variety of features that the policy team is working on. First, we've got our Texas Legislative News, which is posted every Monday throughout the session. Here, you'll find information on the legislative process, upcoming bill hearings, and events such as today's Disability Academy and more. We also have our Bill of the Week feature, which gets posted on Fridays throughout session. Here, we do a deep dive on a piece of disability-related legislation, sharing details on what the bill does, where it is in the process, who supports the bill and why, who opposes it, if anyone. And we also include a quote from the bill author on why they filed the bill or why they think it's important. And this session, we're also producing an informative one-pager on each bill of the week, which you can share with your network or with your elected officials. We featured 7 bills of the week so far this session, and 3 of them have already been passed out of committee. You can also sign up for alerts on the TCDD website to get the legislative news and the bill of the week placed directly in your inbox as soon as they're posted. And lastly, I'll mention the TCDD Instagram feed, where I'm providing short video updates throughout the session. And if you're looking for details on capital activities in 90 seconds or less, this should be your jam. These posts are available on the TCDD website, as I said, so please follow along and share. And that is enough self-promotion from me, but I do want to quickly mention that Disability Rights Texas had hoped to participate in this discussion, but they're currently attending a legislative hearing at the Capitol. So sorry they weren't able to join us, but you know, they're doing amazing work as well. So I'm sure you'll be hearing more from them. Let us move to questions in the remaining time that we have. Corin Vogel, the TCDD Council Business Director, is going to help us sort through these questions. Corin, I know we've been answering as we've been going along, but what do we have remaining?
Hi, Scott. And just to let you guys know, as I think Scott mentioned earlier, we're working on getting that document from Linda so that everybody can see it. Let me see. We have a question from Noreen Gill. Let's see. Here is some additional, she offered some additional information on the HHSC individualized skills and socialization. Day habilitation providers must provide services based on an individual plan of care. The rate method changed based on the level of need and individual services. There are two types of rates, an on-site or in-facility rate and an off-site, which is a higher rate. Many providers will provide both on and off-site services. The development of the ISS rules and implementation are in response to the federal home and community-based services setting regulation effective March 17th. The Fed's extended implementation of this rule in 2017 to 2022, and then again in 2020 to March 2023. So thank you for that added information. We've got comments that how much they love the bill of the week emails. Okay, so here's a question about vouchers. And will there be accountability for private schools who receive federal funds? All other entities are required to meet federal mandates for special education in Section 504. Is there specific information in the currently filed bills to address this issue?
Linda Litzinger, do you want to, or Jolene, I see you pop your camera on. Do you want to answer that one?
Yeah, well, like many of our partners, CTD is opposed to funneling any money away from public education, which includes, school districts and open enrollment charter schools across the state of Texas. But for this specific reason is the biggest concern. They are not, because unless they receive federal funding, they do not have to comply with the Individuals with Disabilities Education Act or Section 504. And so there's no requirement to have those plans in place or to have any plans in place. They're not required to provide transportation. They're not required to provide at no cost to the family related services like speech or OT or PT or counseling. They're also not required, even though some private schools are accredited, they're not required to be accredited. And so they don't necessarily have certified teachers. And that's the great thing about, we know under IDEA, special education students have to have a certified special education teacher. That's not required in private schools. And something that's, personally would be really scary for me is if the private school is not accredited, they don't have to do background checks either. They can choose to do that, but they don't necessarily have to. So the short answer is they do not have to comply with IDEA or 504. And so I think that's a misconception. A lot of folks don't know that essentially you'd be waiving your rights. In Tennessee, they actually have parents sign, I understand that I'm waiving my rights if they access an education savings account. So it's very problematic for a number of reasons.
I guess I'd like to add, we typically hear that it sounded so promising in the beginning, even though they knew they weren't going to have IDEA rights, but at about month 2 or 3, it sort of breaks down. And then the school's looking for a way to suspend the child, to not admit that they were the ones failing the child. So parents just need to go into it with very open eyes is my recommendation. Thank you.
Thank you, Linda and Jolene, for that. I see that we have a question regarding capital advocacy days. Do you have any capital advocacy days planned that we can participate in? Chris, I don't know if you want to respond to this. I know that the Autism Society has one coming up.
Sorry, can you hear me?
Yes.
Yeah, absolutely. The Autism Society is on April 4th, and we have an Autism Day. There's a registration on the website, texasautismsociety.org. I think it'll be I'm not sure how many people will be there, to be honest, 150 or so. We also have on March 21st, the Down Syndrome Advocacy Coalition, which is a kind of a loose confederation of all the Down syndrome focused associations, as well as individual groups and cities. Will be there on, again, March 21st, and TxABA has their Capital Day on 3/29, March 29th. Trying to keep all those straight. There's an awful lot of bills. I hope that we have hearings for some of those things, but we may be talking about budget a lot. Thank you.
Excellent. Thank you, Chris. Does anyone else have an advocacy day that they want to plug or any upcoming events at the Capitol from our speakers? All right. I know that I want to go back to you, Jolene, real quick, because there is a question at the very top regarding training for childcare providers for children with disabilities. Sorry, Corin, I'm just and the question is, will programs such as the CLASS program or other state agencies provide this training? So do you want to highlight who would be providing the training?
Yeah, so currently we're already pre-service and annual professional development training that's required for caregivers and doctors. So back in 2011 is when they created this childcare training registry in the state of Texas, essentially to make sure that, you know, like my cat couldn't just say, yes, I do. You know, I do childcare training. You have to kind of go through this application process, and there are different tiers for people who can train. There's certain different requirements now for training. So that already exists. There are also free trainings through a number of different state agencies and entities. But there are certain buckets right now in childcare licensing minimum standards where you have to have so many hours in this, and, you know, discipline, health and safety, child development, and then it has this other category that's kind of like, pick this if you want. And one of them is working with children with special needs. And we believe that should not be optional, because you're going to have at some point a child either identified or not identified with a disability in your care. And so when we're talking about really being inclusive in within the childcare setting, that's going to require some additional information for those who are caring for kids. So there's already a ton of training. We just want to make sure that, and there's tons of training on working with kids with disabilities, and even on what early childhood intervention is. We just want to make sure that it's not getting left out because, you know, it's optional. We want it somehow woven into, say, for instance, their training that's required on child development. We want to ensure that that also includes perhaps identifying red flags if there is a child who is, you know, appears to have potentially a developmental delay. So that's kind of like, instead of like, we're going to leave this optional, we want to make sure that they are accessing the trainings that already exist out there.
Excellent. Thank you, Jolene. So we've got two questions related to public education funding. The first question relates to, how do we find out how much funding is given to each district and when funds are distributed? And there's also a payment or question about the weighting the needs of the child in payments for public schools. For example, a child that has a visual impairment, has additional ECC skills that they have to meet. Will this change prevent asks for placement? Sabrina, are those questions that you might be able to respond to?
Yeah, I can do so to the best of my ability. So with that specific question related to, will this change in funding formula model change preventing asking for a specific placement? And the answer to that is no. You should be able to still be able to have your child placed in the educational setting that is best for their educational needs and their special education services. And nothing about a funding model change should change that at all. What it will change is what it will most likely change is how much funding is brought down to your student's school to be able to pay for those services, if that makes sense. I hope that that's making some sense, just because it'll be based on the specific specialized services that your child receives, and not because they spend 80% of their school day in a self-contained setting. So I hope that that's a little helpful. And as far as on the funding of schools, how do we find out how much funding is given to each district and when funds are distributed? You would think that this is very easy and accessible information to find out, but it's not. I'd be happy to follow up with some resources on how to find out this information and how much each school district is allocated. But unfortunately, it's not on a setting where you say, you know, my child Susie, I know that she is getting X amount of dollars for her education. That's just not how it is. But I'd be happy to distribute that information. And Linda looks like she's able to speak a little bit to that as well.
I just wanted to say that the old way was based on a placement of where you were. If you were in self-contained, you would get the most money. And if you were in a regular classroom, you would get the least, even if you had a full-time interpreter or para or something. And they're moving away from that instead of toward that. Thank you.
Thank you, Sabrina and Linda. We've got like a minute and a half left. I just want to there's a question regarding, I agree with the increasing the wage for caregivers because it is not a simple task, job, or occupation. Most provider agency lists are not updated for direct services agencies or case management. How do we hold agencies, state agencies, accountable to update these lists? That is a good question. I don't know if one of our speakers has an answer for that. I will say that that is something in part for lawmakers to look at, and perhaps we talked about budget riders earlier. That might be a solution for that, providing some direction to the agencies to insist that they keep those lists updated. But that is a question that we can certainly look into moving forward. With that, we are approaching the 2:30 mark, so I do want to stop here. I want to thank everybody for attending the event. I want to thank all of our amazing panelists for participating. As I mentioned repeatedly, we will send some follow-up materials that have a link to the recording of the video, that have links to some of the other resources that were discussed. And again, we will try and provide a breakdown of a list of the bills that were discussed over the course of the presentation. So with that, have a good day. I hope to see you all at the Capitol, and please don't hesitate to reach out to TCDD if you have any questions about what's going on. So thank you very much, and enjoy the rest of your Wednesday.